Hello. So I want to briefly talk about the issue of cervical cancers. It's imperative that we discuss cervical cancer, especially now we have a lot of scourge or burden in our environment, sub-Saharan Africa. Nigeria is part of sub-Saharan Africa, and our women should know about this because we should not be having cases of cervical cancer if and only if we do what we're supposed to do. And what are those things? By having the screenings. We still have today three emergency. You see women. Sometimes these are women that have finished seeing their menses. They will start bleeding again and they will come to the emergency room with very foul smelling vaginal discharges. And you wonder what is happening. And most of the time, it's the women that have cervical cancer. So now, cervical cancers are malignant lesions of the cervix. One we want to know what is cervix. Cervix is the mouth of the womb. Every woman has a womb, and that womb, well, let me not say every because some people do not, but a complete woman should have a womb, and that womb is accompanied by cervix. Not all women have cervix, but we're talking about normal women where there is a womb and a cervix. That cervix has the tendency of undergoing some changes, and those changes can lead to cancers if not monitored. Now, cervical cancer is pretty um, common, especially in our environment where women we have these lesions. They don't get checked, they don't get tested until it graduates to cervical cancer. So usually one of the good news about cervical cancer is it cannot just start immediately with the lesion, what we call the pre-malignant lesion. Malignant means cancer, pre-cancerous lesion that will move. In fact, most of them take at least 20 years before they can move from the pre-malignant lesion to invasive cervical cancers. And because we have a robust screening that gives us room for us to detect that makes cervical cancer very, very peculiar and very special, whereby that means women can actually have the privilege of being screened, tested, and treated, and they will have complete cure. So cervical cancers, how do they come about? Usually, in the past, we were not very sure what actually causes cervical, but recently it has been shown that the virus called human papilloma viruses, they are DNA viruses. They are actually the culprits in about almost 99.7% of cases, or in the excess of 90s, as the case depends on the literature you are reading. They are the ones that causes cervical cancer. So the question is that what are the HPV? How do we know that we have HPV virus? How can a woman know? Now, women might not necessarily know that they have human papilloma viruses because sometimes they don't show any a symptom at all. All right. So that again, that's why it's important for screening exercises to be done on these women, especially for those that are eligible, which we are still going to talk about. All right. Now, let's look at the risk factors for cervical cancers. One of them is having multiple vaginal births. You see that most cases of cervical cancers, you see women that giving birth to six children, 7, 8, 12, 13, and all that. So that is a possible um, risk factor for cervical cancer. Now, early age as sexual debut is also when you have early marriages, maybe children that are just 12 years, by then they start having sex. At that time, the cervix is bound to have a lot of injuries, and that can also create a possible site for HPV infection. So we also know that people that are immunocompromised, like HIV virus patients or patients who are on chronic steroids, are at risk of this cervical cancer. Then oral contraceptives can also predispose. Now, the one of the link that COCPs that they are called oral pills for contraception can lead to this, that women that are on say combined oral contraceptive pill believe that they are protected, and they will forget that multiple sexual partners can also lead to cervical cancers. All right. So multiple sexual partners is also one of them. And these are, issues. These are risk factors that can lead to cervical cancer. Then for there are women who smoke, cigarette smoking, and also being associated, and also it can also run in family if there is first, especially first degree relatives. If the auntie or the mother has cervical cancer, that woman should be very careful because he might also have cervical cancers. All right. So now, how can women know that they have cervical cancers? Remember, we said that it's not all HPV infection that can lead to cervical cancer. But let's quickly talk about serotypes. Now, serotype HPV DNA viruses have up more than 120 serotypes. There are so many of them, but we will localize, or center our discussion on the commonest cause of the serotype that can cause cervical cancer, which is serotype 16. Serotype 16 can cause up to 70% of cervical cancers, followed by serotype 18. All right. There are other ones that are intermediary, serotype 31, 33, and among others. Now, but for serotype 6 and 11, this one can actually cause the genital warts. All right, you have people that have warts is caused by HPV papillomavirus infections. All right, so let's now come again to how will a woman that has cervical cancer know? Usually, here is a woman who's supposed to be menopausal. Remember that menopause is when people there is a complete cessation of menstrual cycle, at least for a period of 1 year and above. So this woman is no longer having menses. All of a sudden, she starts bleeding. That cause for concern and of course for checks. Or for a woman who may not necessarily be menopausal, but start having what we call postcoital bleeding after having intercourse with the husband, and she discovered that she's bleeding. This is not very. This is a red alert and should be monitored to find out what precisely is going on, right? Yeah, so now there is a foul smelling vaginal discharge that is quite, sometimes people can also have waist pain, especially all these symptoms are when, remember, when the lesion is confined to the cervix. In fact, when the woman start having symptoms, that means definitely most of the time we are dealing with possible cervical cancers. Now, so let's before we go further, let's talk about the screening exercises. Now, okay, before we say other things, we should also know that when it becomes the cancer has metastasized to other parts of the body, then you can have manifestation of direct spread, hematogenous spread, and all that. Direct spread can spread forwards, affecting the bladder, urinary bladder, leading to blood in urine frequency. You might think she's having urinary tract infection, can spread backwards or lateral and all that. Woman might, also have, the issue of affecting the rectum, but most of the time they spread usually on the lateral, by the sides. Then can also go up to the chest and also to the brain and what have you. All right. So, now, cervical cancer is important we look at the screening exercises, because if we do not talk about the prevention, usually prevention is classified into primary, secondary, and tertiary prevention. Primary is more of awareness, education, and information of the general populace, which is what we are doing right now. Then secondary infection is a situation whereby the individual has had the disease already. What are we going to do? We talk about the treatment protocol and all that. When it's at the level of premalignant lesion, what are we going to do? When it's already basic cancer, what are we going to do? Then, of course, the tertiary is now talking about rehabilitation. After treatment, how do you follow up these patients, and among others. Now, the robust discussion here with more of information and the education and the counseling, for on the general population about cervical cancers. They should know, we talked about the risk factors. They should know about the screening. They should know about vaccination. Let's quickly talk about screening. World Health Organization recommended that screening exercises should start from age 25, especially for the people that are sexually active, because each time we talk about, we're talking about sexually active individuals. All right, from age 25, and every 2 to 3 years, there should be a repeat screening, to see if they are going to see any pre-malignant lesions. Usually, the screening exercises can follow the perpendicular smear. What we simply call the pap smear can also be, it can be used. Is usually the commonest that is used to see whether there are pre-malignant lesions. Other ones are HPV DNA screening testing. This usually, when this is either is qualitative, either is negative or positive for HPV. Usually, when they are negative, the individual might be due for another screening in the next 5 years, all right, because it's pretty more sensitive when compared to pap smear. But most of the time, they are complementary to each other. So the screening exercises are very, very important. And also, we should know that at this level, people must know. Then the issue of the screen, we talked about the screening. Then the issue of vaccination is very important. Vaccination, usually the target is before sexual debut, especially in girl children. By extension, we can also give this to the male children, but usually the center point is on the females. So between ages 9 to 13 years is the first catch. Then after that, we look at between ages 13 to 26 years. All right. But that does not mean that if somebody is above 26 and still want to be vaccinated, she cannot vaccinate. There are pretty different vaccines. We talk about the Cervical, the Gardasil, and all, and of course the Gardasil 9, among others. So whichever one that is available, the individual should benefit from this and get vaccinated, feel the verge of prevention. All right. Now, if there are lesions already, the individual should be treated by, of course, the gynecologist, where there is available gynae oncologist, and they can benefit from lip surgeries, they can benefit from conization, depending on the lesion that is seen. And of course, the rehabilitation is important. If cervical cancer is left untreated, they can actually lead to vesicovaginal fistula. And in such a patient, that patient must be managed as such. In summary, we want to let us understand that cervical cancer can be prevented. All right, it can be prevented. The scourge that cervical cancer is causing in our environment is needless. About more than 7,000 deaths, by the 2023 data set. So this should not be. And of course, we're talking about in the excess of about 10 to 15,000 cases per year. So why should we still be having this burden if we are having robust exercises? So if you are a woman and you are an auntie or you are a mother or you have female daughters, it is the onus lies on you to educate people around you about having cervical cancers, exercises in terms of the screening or vaccination. Above all, share this message so that if A gets to this message, and especially in groups, so that majority of women will hear this and do the needful so that they can help us stop the spread of cervical cancer in our environment. Cheers.